Well, welcome back to The Short Coat, coming to you from the amazing and intense world of med school at the University of Iowa Carver College of Medicine. I'm Dave Etler, and this week we're talking about medical students' families. They mean well, and their support is always welcome and needed, but sometimes it's hard to explain to them what this med school business is all about. Let's talk about that with my co-hosts, like M1 Anna Royer.
Hello.
M2 Srishti Mathur is here.
Hello.
We've got M1 Drew Bolisay.
Hey, guys.
And M2 Nick Abouassally.
Hi.
Abouassally.
There you go.
That's going to be the whole podcast.
Abouassally. Guys, I'd like to start with what your family thinks it means to be a med student. So when your family says, how's med school going? What answer are they expecting from you?
I think they're expecting that I'm already a resident. They're like, how's it going? And they want to know that I'm doing medicine. You know, they think I'm like on the wards.
Okay.
Even though I've explained 1,000 times how the preclinical route works, they think I'm doing clinical right now. Yeah.
All right.
That's my initial.
You're an M2.
I am an M2.
So you're not there yet.
I'm not there yet.
You're
no.
almost there.
I am.
Not as a resident,
but
as a clinical student.
Yeah.
Nick, do you have the same experience, or?
I would say it's pretty different for me, actually. I have the benefit of having some doctors who were in my family who went here. So they're like somewhat familiar with how things work here. And they understand that like I'm still in school, but I think they expect that I am constantly studying like 12 hours a day all the time. And won't lie, that definitely does happen sometimes. But I think they're pretty shocked to hear about how much free time I have and how much time I get to like spend with friends and like going out and stuff like that. I feel like
when were they in med school though? That's
back in the 90s. So
yeah.
Been a little.
I wonder why. I mean, there's more med school to learn now than there was back in the 90s. There's more medicine to learn. I wonder why they were going so hard at it.
Yeah, I don't know. It's very interesting. They make it seem like it was very cutthroat back then, whereas I feel it's so positive here now that like there's just so much support here that I almost feel like I can't fail while I'm at Carver. Like you guys won't let me fail, which is not that I want to fail, but you know, like you guys just support us so well that I feel like I at least sometimes get to live like a regular life.
Yeah.
Like I go out more now than I did during undergrad, which feels kind of crazy to say. Yeah. And I'm doing well. So.
Yeah.
You guys, you M1s.
Yeah.
How you guys have only been here for like 2 months.
Yeah.
Mm-hmm.
Yeah.
How are you? What do your families talk to you about med school?
Yeah. I don't come from a family that has really anybody working in healthcare. So this is very new for everybody. I think that my family kind of thinks that I'm like still in college. Just in the sense that I'm kind of talking about the same things, like, you know, going to class and going to lab and whatnot. But I think there's been a barrier in that, like, I'm not at that point yet where I'm like having a ton of free time or like I haven't really struck a really good balance yet between studying and like, you know,
will say,
just
like,
living life.
When you get into like M2 or like even like when you finish your first semester.
That's what I've heard. Like there's definitely a light at the end of the tunnel, I think. But yeah, like for now, I think it's hard to kind of explain like how much harder I'm working now than I was like in college.
You guys are in the thick of it right now, and it takes a little bit of time to like get that schedule like, you know, figured out, but you'll get there for sure.
Yeah.
Yeah, I think for me, similar to Nick, I have the benefit of having a dad who's a physician, so that has really helped a lot in terms of understanding where I'm coming from. And also my mom's a nurse, so I feel like she understands the whole healthcare system and what goes on. And I feel like even just having one parent that's a physician, like they're able to tell the other parent like kind of like what's going on, understand my life, so that helps a lot. I feel like one thing that really helped a lot for me too was taking gap years at home, and my parents like just saw how hard I worked all the time, And I feel like that gave them like a big glimpse into my life, because like I was working hard during college, but like they didn't really like understand how hard I was working, I guess, until like I was at home like working hard all the time. They're like,
What were you doing?
just like so I did 2 gap years, and then so I was just like working at my job, and then I'd like as an MA, and then I'd come home and then like work on my applications, or like I would do just miscellaneous tasks like coordinate with like my research PI in undergrad, like try to get like my publication going, or like coordinate with like volunteer organizations like that I worked with to like develop new projects, like stuff for my resume and stuff. So I was just kind of like working around the clock, and like I feel like them like seeing that like now lends so much understanding into where I'm at right now. Like they know I'm working just as hard. And I also feel like one thing that I like is that now that I'm in med school, like people like know I'm busy. Like in college, like I feel like I was just as busy. I mean, like don't get me, actually no, I'm definitely more busy right now.
Yeah.
But like in college, like I was like, obviously as a pre-med, like you're super, super busy. But like I feel like people like you can't really like have any slack like in terms of like developing your application if you want to get into med school. And I feel like in college, like people don't understand that as much. Whereas like once you're in med school, people are like, oh, well, he's in med school, he's definitely busy. So I feel like people leave me alone a little bit more, and I kind of like that.
Yeah. There's definitely some like credibility that comes
So the
with
trick
it.
to having people leave me alone is to go to
higher education. I will say one thing that like my parents and I always like struggle with and butt heads with is my immediate family, there's no one in medicine. So like I am the first to do this, and they do not understand the concept that like I don't get the same days off or like the time off that they do. So like I worked in a scribe position previously, and like my hours were pretty intense, and like I wasn't getting, my mom like works at a university, she's getting like winter break off, and she's like, why aren't we going and doing these things? And I'm like, Mom, I have a job. And she's like, well, you can just let it go for now, like we can take a day off. And I'm like, that's not how healthcare works.
Take a day off.
Just take a day. She's like, it doesn't matter, the patients
Call in
don't
sick.
need you, they don't need you. And I was like, I mean they don't need me objectively, but like there's an expectation in healthcare because of the nature of the work of like, you know, you're working different hours, there is like a need to be present, and that was something that I always butted heads with my family with. And like even with core year coming up, they're like, oh, we can like do something for Thanksgiving next year, and I'm like, no the hell we cannot. I can't, you can, I can't. So I think that's something we've kind of struggled with a little bit, is that like expectation.
What is something your family thinks you've learned here that you have not?
Of
You
medicine.
Absolutely have not.
I was just saying this. My parents, like my dad, like was like, "Oh, my heart's beating fast. Do you know what's going on?" Or he'll like show me his like EKG, and I'm like squinting at the lines, trying to remember what they taught us last semester, and then I'm just looking in the corner and reading what it says it does. Like I don't know medicine like that yet. I don't know it like that yet.
Oh, poor dad.
It's okay. I looked it up. I looked at my notes.
I definitely I have some extended family who is like, cannot be convinced otherwise that I'm not in nursing school right now. So that's one thing that like, and I guess like on my in-law side, I have a lot of nurses there. So it's like probably a kind of benign misconception, but you know, it's like,
You know.
I'm not learning those things that you're talking about. And then I also have some like my grandpa, for example, like I think he thinks that I know surgery. Like the reason that this came up was he got a CD stuck in like he has like an old panel truck that he like, you know, piddles around with. He got a CD stuck in it, and so on Amazon he bought like a pair of hemostats to like get it out, and then he like gifted them to me, or maybe it came in a pack of 2 and he gave them to me, and he was like, this will like really come in handy. And I was like, I don't think I can bring those into any operating room,
Hey,
let alone use them. We're like,
I can imagine.
but I said
like,
thank you.
Showing up in like
like
a scrub text, like absolutely not.
no, literally,
Brought my own hemostat.
just like gonna go rogue and
You can just like pick up the stylus for your like tablet or something.
No,
for your
yeah,
hemostats
find a
and
purpose
stuff
for
like
it.
No,
that,
literally.
yeah.
yeah.
I'm using it to cook. I'm using it to like pick up my things so I can cook food.
you know, here at Iowa, this is sort of a tangent, but here at Iowa, they're a surplus organization where, right now, if you need like an office equipment thing, you could go there and maybe they would have it. But back in the day when I first moved here 20 some odd years ago, they were selling things like ventilators and EKG machines and all kinds of stuff. Now they sell that stuff online.
I mean, that would be helpful. My dad would show up and I'd be like, why don't we run an EKG now in my tiny little apartment?
Do that.
No.
Yeah, you could buy hemostats, you could buy like scalpels, you could buy whatever the heck you wanted that came from a hospital. I've got a couple of stainless steel bassinets in my house, what do you call them? Bases that I use for shelving in my house.
That's incredibly weird.
It is weird, but it kind of looks cool. But anyway, point is, back in the day, you could go get an anesthesia machine and be like, okay, Grandpa, let's do that surgery that you need. Okay. Has a relative ever given you advice, medical advice, or checked your work or something like that?
I mean, I have this ongoing argument with my parents where like they utilize WebMD. And then we're talking about something like me having a cold. And they're like, this is because of X, Y, and Z. And I'm like, well, who's getting the degree?
Yeah.
That's the most I can think of. Okay. I don't know about checking your work.
I think I could maybe chime in on this a little bit. A really big and frustrating thing that like I'll deal with in my family sometimes is if my parents aren't feeling well, or like if my grandpa's not feeling well, they try to hide it and don't want to go seek like medical attention. And I'm very much a proponent of like, no, like something's wrong, go get help. And that I think is really, really frustrating to deal with, especially when we're learning about all these conditions. The big one being my grandpa. He's 87 now and just a terrible, terrible listener when it comes to that kind of stuff. Like the man lived his life taking care of his family, worked 3 jobs. Like he's always been a very independent, hardworking person. And I think like trying to be like, okay, maybe we need to take the foot off the gas a little bit. It's time to relax. Let us take care of you. I think he tends to push back on me on that quite a lot. So I guess that doesn't.
So he's like, you're like, hey, Grandpa, maybe you shouldn't, climb that ladder.
Yeah.
To take down the Christmas lights because you could fall and break your hip. And he's like, oh, I'm fine.
Basically,
he sounds exactly like that. I'm assuming.
Yeah. Like fallen 3 times in the past month and a half. Maybe you should go see a doctor.
Yeah. Okay.
Yeah. And
I don't need a doctor.
Exactly. Yeah.
Exactly.
Which is just frustrating.
All right.
No, yeah. I think it's sometimes like I am getting this education. I do have again, I'm not going to be able to diagnose you right off the bat, but I do have the pattern recognition skills to know like we should get this checked out.
Mm-hmm.
And sometimes I get a lot of pushback on that. And I'm like, well, again, what am I paying out of my ass for?
Yeah.
Yep. And I think it's hard when you come from like a very like paternalistic family where it's the adults always know what's right sort of, and don't listen to the younger generation as much, especially now when that younger generation is becoming adults and is, becoming professionals in these careers that they're interested in. So I think it can be kind of hard to like get the older generations to like listen to you,
Yeah. Yeah, I got news for you. It's that also happens outside of medicine. But it's fine. Yeah. It's fine.
Yeah.
I always say, sometimes you got to set expectations for your parents and tell them this is how it is.
Yeah. You just got to keep
this
trying.
This is what I'm doing. It works out.
Yeah.
Health policy is one that always gets like big pushback.
There's a lot going on.
There's a lot going on, and I don't agree with most of it. And and sometimes that makes for really uncomfortable conversations with
that's fair.
Family members who aren't as like maybe entrenched in like
we can go into it a little bit.
We
can go into it. Like what's an example?
Oh, I don't know. Perhaps like vaccine policy with the
God, that feels like the old standby now. That feels like
I have
I don't know how oh, that's how it's always been,
Yeah.
but it really
It
hasn't.
wasn't. I have a family member who like very, very, very strongly believes that doctors like cause cancer to make money. And that's like one that I've had to like try and like reason with them about.
The conspiracy theory of it all.
Yeah, that's a conversation I've had multiple times, which very interesting always.
Yeah.
What part of med school do you think your mom is secretly proud of? Or whatever parent you want to, whatever family member you want to substitute.
This, I guess, kind of came up like prior to med school, but it was probably like one of the most important things my parents like ever said to me ever, like along this journey, was like, you know, just trying to like apply and do everything and like prepare for the MCAT and all that stuff was like so unbelievably stressful. And I just remember before taking the test, my parents were both like, hey, we just want you to know, like, we are like, no matter what happens, like, we are so proud of you because of how hard you've been working for this. And like that, I guess that just them acknowledging like how hard that we work, I think is like huge. Like that, I think really meant the world to me and very much has like motivated me like from that point on. And that like, I know like being here, like I'm making them proud. And yeah, working my ass off for it.
Nice.
So.
Yeah.
I love that.
Yeah.
It's very sweet.
Yeah, I agree with that. And we've talked about this, but like it's not very common for our parents to say stuff like that to us.
No?
So no, not really. So when it does happen, it's at first I know it's very meaningful when they say stuff like that. And I know they really, 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 truly mean it, because otherwise it's like pulling teeth to get a compliment. But like otherwise, like like when in those moments where they're like, we are actually very proud of you and you are like, you're making us proud to be your family. Like those really mean something.
Right. Like I feel like coming from like a pretty like paternalistic family, like I had said like previously, it can be hard to be like emotionally vulnerable with your kids when it's more so like you just want them to listen to you because you've lived a very full life, like the mistakes that you've made, you don't want them to make those mistakes and stuff like that. So I think it can be hard to like take a step back from that and just be like, yeah, emotionally vulnerable like that and like connect with your kids. So when that does happen, it like means everything.
Yeah.
Like I'm never going to forget that.
You guys want to say what your background is, what your ethnic background is?
I'm Indian.
Yeah.
And I'm
Oh.
Lebanese.
Okay.
Yeah.
Similar
Very similar cultural
Situations.
backgrounds
Mhm.
there, yeah.
what about you guys?
My ethnic background?
No, what would
I was confused about that.
I'm
too.
gonna no, you look pretty white to me.
Yeah, that's fair.
I don't want to make any broad generalizations,
100%.
but no,
I'm sorry, what was the question?
I meant
I don't think
what
Dave
do you
knows either.
what do you think your mom is secretly proudest of?
Oh, I don't know about secretly proud. She's pretty, like every time I go home, she's like, I'm so proud of you. Like,
Oh.
this is so cool. Yeah.
Does she introduce you to other people? Like, this is my daughter, the med student.
Yeah.
Oh yeah, that happens so much.
Yeah.
That's okay.
Feels good when your parents brag about you a little
Yeah,
bit,
yeah.
you know?
For sure. Yeah. No, but I grew up like my two younger brothers were pretty medically complex. And so we were in like hospitals and doctors' offices a lot. And so like when I was younger, I never really expressed interest in going into medicine. And I think my parents, although they never like pressured me into going into medicine by any means, I think they're secretly maybe a little bit proud that like eventually, with like years of school and training ahead of me, like I'll get to be the one who's like helping other families like that. We've never like chatted about it though. We're also not very emotionally vulnerable with each other. So
Okay.
yeah, that's just my my perception.
So my dad, he's an endocrinologist. So for me, like my background's kind of an interesting case because I'm multiracial. So my dad's Filipino, my mom's white. I think it's always been really interesting for me in my life because like my dad's background is kind of like, okay, like you don't like really express those emotions as much like to your loved ones, but then my mom's background is like you express it like all the time and like very, very open. And so like, but it's never like a difference that I really noticed, because like that's my background, is like being exposed to both of those things like my entire life. So it's always just seemed very normal, like one way or the other. And so like I can just recognize that like both of like the ways in which they do that to me like is like equally as loving. So it's like, it's interesting because like, you know, like me being in med school, like my mom will always be like, oh, I'm so proud of you, or like not really like because I'm in med school, because she knows I'm working hard. Like I think my parents are like very supportive like in that aspect, where like their proudness isn't tied to like my accomplishments or anything like that. Like it's tied to like, do I try my best every day to like be the best version of myself? And so like I think like that's what my mom is most proud of, like is like that I'm just trying my best every day, and like she verbalizes that. And like for my dad, like it's interesting because like for him, like he is a physician, and so like he is, we've always just had like a very deep bond in terms of like me following in his footsteps. And like I could just, you know, like it's just you just know that like it means the world to him, because like he sees himself in me, and like he knows like how hard it is to get to this point.
Yeah, you said you had doctors in the family too. Is there any pressure at all to go into a certain specialty or not?
No, so the doctors in my family are like very supportive of do whatever you want to do, which I really appreciate. Like they're very much encouraging me to explore my options, which has been really, really nice. I mean, they joke here and there about like, oh, you come, you know, to like our clinic for this or that or whatever. But no, they haven't really pressured me, which has been nice because I'm interested in a specialty that I don't think any of them have much experience with.
Oh,
so,
okay. So what specialty?
Neurology,
okay.
I think, which just kind of came out of nowhere.
Yeah.
So, yeah.
Did you come in with an idea?
Yeah, oncology. I worked at the hospital in the hem-onc unit for like 2.5 years during my gap years. And like my grandmother also died from cancer. And I had a little cousin who had Ewing sarcoma. He has a below the knee amputation. So like cancer is something that's very personal to me. But I have just like fallen in love with the nervous system and the brain. And it's just so fascinating to me. And I shared that with them the other day, and they just blew up we have our like doctor group chat. Aww. And they just blew it up with like, here's all these recommendations. Here's all these neurologists we know, like so much stuff, which was,
yeah, you got to admit having a family of doctors
helps.
It's
nice. It's
a nice support system.
Yeah. You should be able to rent out your doctor family.
I agree. I
to
would
others
love
that don't
to
have doctors in the family, you know?
Yeah,
I agree with that.
Yeah. That was something I really struggled with, especially in my application process, was that of like just not having doctors in the family. And I think
it's hard to know what you're getting into.
It's very
what you're
hard to know,
do.
just like the little details.
Yeah.
The little things. It's very difficult to navigate that without any sort of support. But like, again, my family did the best they could, and we have extended family who are in medicine, so I wasn't completely without that.
Yeah.
But I do think it makes a difference. Yeah.
If your family could see a 60-second highlight reel of your med school life, what clips would they see?
I would say a lot of writing on whiteboards for sure. Definitely us sitting at the table in McCowan,
Yes.
just kind of wasting time
We
as
do a lot
well.
of that. We
A
do
lot of
that.
just like someone brings up some topic and then it just turns into like an hour and a half discussion about like the
Yes.
most arbitrary thing ever.
A lot of Anki for me. I use Anki a lot.
Couldn't be me.
Okay.
Yeah.
Okay. No, okay. Yeah, that would be it for me. Lots of Anki.
What about outside of school?
A lot of sleeping. I'm tired.
Yeah.
I'm a sleepy girl.
Yeah. I can see that.
Thank you.
Yeah.
A lot of lifting weights.
Yeah, I was gonna say, I feel like my reel is just school and the gym.
Yeah, for sure.
I don't know. Probably either being here or like walking my dog. That's like a part-time job in itself. Like, I mean, like she needs walked in the morning and at night, and so then that's like my
That's all your free time
my
gone.
non-studying time is walking the dog. But I don't mind.
sounds like a good way to spend your free
sounds
time.
great.
No, it is. It's very, yeah.
Video games. Definitely going out downtown whenever we have the time to do so.
I would say for me, there's really not any more than that. It's literally just school and gym. I'm trying to adjust right now.
That's true.
It's
Like
hard.
these guys are in their first
Yeah.
2 months.
Yeah, I feel like I am starting to get to the point where like there is like I can see a glimpse of there being a little bit more, but like, and I'm starting to get excited for that. Like all my hobbies coming back into the picture, but like right now, like it's not like that. I don't know about you, Anna.
No, yeah, I feel the same way. I think the first week in November is our first week. It's like we're in the 8-week, exam every week situation. It's like kind of infamous here.
Yeah. So maybe for people who aren't familiar with how we do things here, describe that first few weeks.
Sure. Yeah. So you get here. You've got an exam next Friday. And that's just how things go forever.
Yeah.
No, just kidding. It's like I think your first exam, it's like, week 1, exam week 2, week off. And then for 8 weeks, you have an exam every Friday. And I think this is week 6 of that.
Oh, you guys
Yeah,
are almost
it is.
5 of
Yeah,
that.
this
So
is week 6.
over the hump and feeling pretty good. Just, got to clock in for anatomy next week. And then I think we'll keep going.
I remember during my 8-week stretch, I was like, I finished an exam and I was like, okay, we're doing pretty good. We must be on like week 6 or 7. And then I look at the calendar and it's week 3.
Yeah.
And that absolutely crushed me. That was brutal.
Yeah. It's like you get to Friday after the exam and you're like laundry all over the place, dishes just
Oh,
like
gosh.
piling up,
Yeah.
like
Yes.
garbage needs to be taken out. You're like, all right, gonna spend the weekend cleaning.
Yeah.
I
Yeah. If your family came to your apartment,
I would have them come
They'd
on
be concerned.
Saturday.
Yeah.
They are coming on Saturday because I still need to go back to my apartment and clean now. Like that's my plan after this.
Yeah.
I feel like it will literally take a whole day to get my life back in order. it's like work hard the entire week, and then it's like, all right, like either like Friday night or Saturday, it's like I have to do like all of the other things, like groceries,
I need
clean
to buy
my
food.
clean my
Yeah.
apartment, like get a haircut, like everything.
I feel like a couple times a semester in undergrad that would happen, like when you've got like, 3 exams in a week.
It's like finals week or something.
Yes. Yeah. And it's like, oh, the exam week apartment is like kind of looking bad. And it's just been like that for a
It's just every
while.
week.
Yeah.
Forever. Just wait till like the big life events like start really coming up too. Where like I've been to so many weddings since
I
medical school
know.
has started. It's crazy.
Yeah, well, it's prime time. Assuming that you're in the like usual demographic for
Exactly.
med school, it's
Yeah.
like 22 to I don't know 28 or something. Like
Exactly. Yeah. Like I just turned 26 and like all of my friends have been like getting married and close friends. So I'm in the wedding. So I have to be there for everything. So like this weekend, I'm like, okay, I have Sunday night basically to do all my meal prepping and try and study for our exam for next Friday and like all this stuff, which will be stressful.
Yeah.
But I'll do it. It'll be fun.
Yeah. And like you still have family obligations. I'm
Yeah.
going home this weekend for Diwali. And like that's my priority. That's something I'm looking forward to and I want to do and I want to spend time with my family. But like I'm also very behind on lecture.
that. Yeah, you
and I
still got
have
to shoehorn in the
I
rest.
still got tons of other stuff to do. But I do think it gets easier. Like especially come second semester, I had a lot more time for my hobbies. I was going and thrifting more and crafting more and doing all of my little tasks. So like my highlight reel is a little okay, Dave.
My little life.
Okay. No, yeah. But like I think my highlight reel would be a little more interesting than it was first semester for me at least.
Like we actually go do stuff like as a friend group.
We
now.
do.
Yeah.
We like hang out.
Yeah.
It's crazy.
Yeah.
Yeah, I know.
What is something that your families say to you that's meant to help, but maybe makes things worse?
It's just a season of life. It's going to be so worth it. You're going to make so much money. That's a comment I've gotten.
The season of life.
Yeah, it's a season of life. So don't worry about it.
And why is that not helpful?
Well, it doesn't, I think it like kind of minimizes the, not to be dramatic, but the suffering. Like
Yeah,
just
yeah,
because it is temporary, like it's also hard. Like two things can be true at once. So
season of life and it's blizzarding outside. Please God.
Yeah. This season sucks.
Season sucks.
I don't like this season. I'd like to go to last season where I wasn't doing this.
Yeah.
yeah.
Well,
Yeah.
Also, I feel like, our parents love us and want the best for us. So like they probably don't really want to imagine us suffering. Like they don't want to think that that is something that we're going through. So it can be kind of hard for like to, show them that like, yeah, maybe I am not having like a very good time right now. So I think that can be like kind of a challenge.
Yeah, to go along with that, this doesn't happen to me as much anymore, like I said, because I spent those 2 years at home. I feel like my parents like really started to understand a lot more about my life through that. But back then, like my mom would always be like you like maybe like you should skip the gym today because like you have so much work to do. Like like you get like an extra like 2 hours back in your day or whatever. But I'm like, I don't think you understand. Like I need that time. Like that's my time to like decompress. And like,
this looks optional, but it's not.
Yeah, because like there was like a good amount of time where like I did do that, where I was like, okay, you know what? Like I'm just gonna skip the gym or like my activities or whatever, and then like I'll just keep grinding, and then I go crazy. Like I can't like just like look at a screen all day or do that. Like I gotta like engage with like the world or my body or whatever.
As I've progressed in med school, I've heard more and more of like, you should take a break, you should relax. I think it was kind of what we were talking about earlier. I have a sense of credibility with my family now that I didn't have before, and just like
because you're an adult or because
I'm an adult and because I'm in med school, both. And so there's a little more of like, you can relax a little. They have a bit more faith in me knowing my schedule and my limits and when I need to do stuff that wasn't there before. Yeah.
What kind of support actually helps then?
Food. Oh my God.
I was waiting for that.
Food.
Yeah.
I don't know why it took me so long. Anytime they send food, that's the prime currency.
Yeah.
Give me food, I'm happy.
That's like,
I don't want to cook.
Yeah. One of the most amazing things that my mom does, because my parents are within an hour away from here, is every time she like makes meals, she'll make an extra portion, set it aside and freeze it for me. So when I go home, there's just like all of this frozen food that I can pick from, which are like, your mom's greatest hits. Like
That's
I get
the coolest thing.
yeah, which is like so nice. So then like the night before like a really hard exam or something like that, I can have like one of my like favorite meals from my childhood, which is just like so comforting.
Yeah.
Yeah.
I'm in the middle of my mom's greatest hits right now. It was awesome.
I'm going home to get those.
Yeah.
That is awesome. Yeah, like honestly, like my mom did like a great job with this. Like she visited me a couple weeks ago and she just brought like tons of frozen stuff like that. She made like my favorite foods from home, and then just like they're all in the freezer, and like now I'm just defrosting it, like coming back, and it's like boom, I make it. Now I have leftovers. That thing is going to last me. Like now I get like my greatest hit like 3 days in a row.
Yeah.
Right. Dude, or Costco. Like my dad will sometimes just come here for work and then be like, I'm stopping at Costco. What do you need? And he brings like 3 times what I asked for. And I'm just like, okay, well, I have enough food for a month now. Like,
Yeah, just like the unsuspecting grocery hauls. Or like my mother-in-law brought like some freezer meals for like white coat ceremony, and like we haven't used them like regularly. Like there was like 3 or 4, but like on like the really dire nights where it's like cannot be bothered to cook, it's like having one of those in the freezer is really
Food.
really good.
Yes.
Yeah.
It's so funny. My roommate and I, our freezer is just filled with frozen Indian food from both of our families. Like that's all it is. There's nothing else in there.
I feel like it's even better when it's like food that like you can't get like locally, right? Like it's like food that like only like your family makes at home, and then it's like
and I
you can have
can't
that.
cook that stuff for shit. It's not
I know.
gonna be me.
My mom is a great cook, and we just don't, as a family, we've never really learned how to prioritize that. Like I'm not going to do that. But yeah, when I get that, mom's spaghetti sauce or chili or whatever, nothing will ever equal that. And so, yeah, it's such an amazing way to support your kid.
one kind of like roundabout way that my dad shows support. So my dad works within like healthcare, like pharmaceuticals and stuff like that. So knows quite a lot of the doctors who are like in this building. And the amount of times that I have heard some of these doctors tell me how proud my dad is of me is crazy.
Sweet.
That's so cute.
And it's like so sweet. Again, like we talked about, like it's nice when your parents brag about you. I remember that happened before one of our really hard exams last year, and Dr. Harris was like, "You don't even realize how proud your father is of you." And I like was like, "Thank you very much. I'm gonna go right. I have to go. Yeah, I have to go now. Like,
There's dust in my eyes.
yeah, like I'm just gonna go cry in the bathroom real quick. Like, you know." So
Every once in a while, we all sort of fall short of our own expectations. Do they help with that?
Yeah, 100%. Like, I wouldn't say this is necessarily like falling short of my expectations, but it's definitely in the same category as like, so I was kind of going down the path of like doing research, like doing a PhD. And this was while I was in college, and then eventually I transitioned back to MD. But I was pre-med before I wanted to do a PhD. And so my dad, I think he kind of recognized that, and he wrote me a letter, which I truly like this is like, I always like think about this. And like, he said like, your adventure is my adventure. And like, I think like that was truly so beautiful to me, because like he was really saying like, I don't care like what you do, as long as it like makes you happy, and don't think about anything other than that. And like that meant all the world to me.
I'm going to cry on your behalf. That's
I know,
so
that's
sweet.
amazing.
That's so sweet.
I remember it's a totally different realm of falling short, but I remember in college I was having a tough time with the ladies.
God damn it, Dave.
I looked at Srishti. Tough time with
damn
the
it,
ladies.
Dave.
And I was complaining about it to my mom, and she offered to go get the letters that my guidance counselors wrote about me. I was like, Mom, I appreciate that.
Like, what kind of letters? Like,
I don't know, like
therapy notes?
No. No, like how awesome I was.
Oh, okay.
Could you imagine like you're scrolling on a dating profile and you see a guy's profile and he has his like high school guidance counselors? Oh God.
I think you should date that person because
Yeah,
that person
they're
is
clear-
cool. He believes strongly in education. The ladies.
Oh.
Oh. All right. If you could give your parents one honest sentence about medical school, what would it be?
I mean, I would just want to tell them like my being here is acknowledging how hard you have worked to give me like the opportunities that I have. Like, especially my dad in particular, like was a refugee from like the Lebanese Civil War and everything like that. And I've heard, plenty of times the full story of like how my family came here, and like, my grandpa having 3 jobs, my grandma having 2 jobs, my dad being 11 years old and being a stock boy to bring in money, and my aunt having to take care of like all the younger kids. Like, and like to me, that was always like a very big motivator to like really push myself and get here. So like, I guess I would want them to know that, yeah, my being here and like working as hard as I did to get here is like an acknowledgement of that.
That could also be a lot of pressure, though.
Oh yeah,
Yeah.
definitely. But I don't know. I guess I can't really tell you how I developed like a healthier conception of that, but like, yeah.
Okay.
Yeah,
Yeah.
I think aging gave me, but like a lot of the same stuff, like me being here is proof that you putting that work in and you putting that effort in was worth something.
Yeah.
And like it does have a lot of pressure that comes with it. But I think, like I said, like, as I've aged and gotten older, we've come to this like understanding that like I know what I'm doing to a certain extent, and like they've come to trust that.
This is my sentence to them. I know that I complain a lot, but this is also like everything that I wanted. So,
Okay.
yeah. Again, 2 things can be true at the same time.
Absolutely. I always say never. I would never take away a medical student's God-given right to complain. Because there's some things to complain about.
And yeah, I love both of those like themes from you guys. 'Cause that is so true. Like I feel like, yeah, I do complain a lot, but yeah, this is my dream. Like this is genuinely like what I want to do. It's funny because like when people are like, oh, like, how are you doing? And then like people are like living the dream, like in like a sarcastic way. It's like, no, that's like actually what, like, that's actually what I mean. Like in like a sarcastic way, like this is hard, but like also like, yeah, it's true. Like I'm literally living my dream. And so like, I think like that's an awesome theme. Same thing with the parents. Like I totally feel that way. Like I feel like me being here, like I just feel like it's not like all on me, like that I'm here, like my doing. Like I feel like so many people have played a part in my journey. So many people have served as role models, and I just feel very humbled that I'm here. I don't feel like that it's anything that I did. I feel like I just tried my best every day, and it's up to like the other people around me, the way they supported me and everything like that to bring me here. So I just feel very honored.
Something that like one of the now M3s, Clara, had shared during one of the panels last year during our orientation, where she said like anytime that like I'm struggling and stressed out, like studying for an exam, I just think about how badly I wanted to be here last year.
Yeah.
Or, you know, like when I was in my gap years and stuff, and that keeps me going. And that's been like a huge, huge driving force for me.
Definitely. I was just talking to Dave before you guys all got here, and like the interview group was here, and I was like, that was very surreal. Like literally about a year ago, that was me like begging them to let me in, and now I'm here, and I have so many like complaints every day. But yeah, that's a good reminder to keep you going.
Yeah. Thanksgiving is coming up, you guys. And you know what that means?
Colonialism? I don't know.
I was going to say turkey, but yeah.
No, it means you go home to visit family and they ask you about their rashes. Will you be prepared to diagnose Aunt Bunny's weeping sores?
No.
And peer at Cousin Jim's white flecked tonsils? Will you be prepared to translate what you know into terms they will be more easily able to understand? That's what we're here to find out. So we're going to play a little game. Here's how this works. One of you is the student and one of you is the family member. The student's job is to guess the family member's condition. The family member's job is to tell the students their symptoms without revealing the diagnosis, using the diagnosis, family relationship, and personality quirk provided at this place. So go ahead and you guys can all go to this place now. Okay. You won't use it until a bit.
I did set my phone down.
Yeah, I as well.
Away from here.
Where did you set it? Oh, go get it.
Oh, okay.
Take your time.
Yeah, I'm gonna get mine too.
Oh no. I'm so scared. Oh no, it's not loading. That's terrible.
It is too.
It's nice having doctors in the family because then people
Wait,
don't ask me. They just ask the doctor.
100%.
Yeah. Well, maybe they'll be testing you. They'll be like, "So, Nick, my elbow's dry. My weenus is dry." What? All right. So let's start off. Let's do the M2s first.
I knew you were gonna say that.
Because I
knew he was gonna do that.
I just feel like you guys, have a little bit more experience.
Sure.
So we'll have Srishti be the family member. Tell them about your situation.
Hi, son.
Hi.
That's how all great family interactions.
Yeah, right.
Hi, son.
Okay, it'd be more of like a hug, like,
Yeah.
hi, Mom,
No, it
how
would
are
not.
you?
No, it would
More
not.
I hug my mom. That's crazy.
We'll do a high five.
Okay.
Sure. I'm in agony. Everything in my life sucks. I'm in so much pain all the time, and it's because I have to do all the work around this house. No one helps me with the dishes. No one helps me with the laundry. No one helps me with the cleaning. No one helps me with the cooking. You're off at college doing God knows what. No one ever helps me with anything, and I'm in pain, and what are you going to do about it?
Well, yeah, definitely. I mean, you do a lot of the work here. I can acknowledge that. Where's your pain though?
Oh my God. Everywhere. I feel like I'm lifting the entire world on my back. Everything is on me all the time. And also our neighbor's dog just shit all over our lawn, and I really hate that. And also there's like this stupid kid running around the block, and I feel like no one in this house cares about me, and everything sucks. And also once upon a time the mailman, I don't know. I forgot my train of thought. It doesn't matter. My back hurts so much.
The mailman.
I was going on a train
So
and I
many
forgot.
directions we could have gone with that.
Okay, well, first of all, Mom,
And also, why don't you ever come home? Why do you never come home? Why don't you ever pick up your phone? What the hell?
well, I'm studying all the time. I'm sorry. Like, I'll try to be a better son, but I'm trying to work hard to get good grades in medical school. Have you been to a doctor yet with your back hurting like this?
Why on earth would I do that?
Because, Mom, something's
Why
wrong
on
and
earth
I'm
would I
worried
do
about
that?
you.
Why on earth would I do that? Do you think I have time to go to a doctor when I'm running around the house like this? Do you think I have time for that? No one helps me with anything in this house. Everyone wants to find everything. Just use your eyes. Look for it. It's right in front of you. Where do you think it's going to be? On my head? It's not there.
Okay, so let's just take a step back. First, can I do anything for you? Do you want water? Do you want some ibuprofen?
Now you ask? Yeah, I'll take ibuprofen.
Okay. Well, actually, I think we have some right there.
Oh my God. That's crazy.
Empty.
Why do you have that?
I don't know.
Okay, so can you just at least tell me, like, is there something specific that hurts?
Oh, everything. I wake up and I'm in so much pain, and then I think about all the things I have to do throughout the day, and it's just really, really hard. But like my back hurts, I guess. But also it hurts when I sit, and it hurts when I stand, and it hurts when I walk around, and it hurts when I lift my arms over my head, but also when I put my arms down. And just everything is so hard, and everything is in pain.
So everything.
No, but it is my
hurts.
back.
It's your back.
Yeah.
Okay, I see. Well, what have you done? Like, have you done any like heavy lifting recently?
Obviously, I have to do the laundry. I have to do the cooking. I have to do the gardening. Of course, I'm doing heavy lifting.
Okay, well, you might.
No one else in this house is doing anything.
You might have pulled something.
Hey, Mom. I'm gonna go back to school.
Yeah, right. Well, you might have pulled something, so you take a break. You gotta relax a little bit too.
I take a break. Nothing in this house will ever get done. How do you think that food magically appears in your fridge?
Okay, fair point. But I do like to cook for myself a lot, so you can let me take care of myself a little bit too. It's okay. Like,
so you don't need your mother anymore?
Of course, I need my. Getting too real. No, you need to
close to home.
take some time for yourself. Take a break. Go lie down. Put some ice on your back. Just relax a little bit.
Do we have any information at this point that we can?
I'm working with what I was given.
I feel like you pulled something in your back. Probably that's.
I think you're probably right, son.
Yeah.
What was your diagnosis and your other information you were given?
My diagnosis was sedentary back pain, so I didn't actually do that. I just kind of went off the rails. Family role was mom, and personality quirk was constant oversharer.
Oh, okay, all right. An angry overshare.
That's the best I could do.
I love the improv.
Thank you.
Good
It was
job.
really good.
You did do a really good job of that. I don't know.
Nick was sweating.
I am sweating. Right? Yeah.
I saw mom, and I was like, I can do this.
Yeah. As you say, we've talked enough about this stuff that she knows how to push my buttons here. So,
Nick, do you want to be the family member next for Anna?
sure.
I also really like how you were literally doing old cards.
Oh yeah, right. I'm a teenager. We'll just say I'm your younger cousin.
Okay.
Oh no, we're switching that one up. That's crazy. The personality quirk was flirts with student.
No.
That's wild. Your cousin wouldn't flirt with
No.
you. Okay.
Why is that an option if these are family members, Dave?
Good question. Good question. I think maybe I originally started off with a slightly different idea.
Yeah.
I never updated things.
Okay. So we're
Okay.
changing the personality.
Perfect.
God, this hurts so bad.
Oh, what's wrong, Nick?
God, my ear is just so painful. I just it's just so distracting and I can't hear anything. It's agonizing. It's ridiculous.
Oh, I'm sorry. You can hear something though, because you answered my question. So can you hear out of one ear and not the other?
Yeah, I can hear out of both of my ears. It just hurts really bad. It's just, I guess maybe like a little harder to hear out of one ear than the other, but like, I don't know. You're in medical school, like.
Yeah. When did this start?
A few days ago, I guess. I don't know. I just like, help me with this pain. This hurts so much.
No, I have to ask you some questions to understand what's going on, okay?
Okay, fine.
Yeah. So it started a couple days ago. What were you doing when the pain started?
I don't know. I was just getting ready for school, I guess. Just got out of the shower, just it's like cleaning my ears and stuff like that, and it just started to hurt like crazy.
Yeah. Did you use a Q-tip to clean your ears?
I did. Oh my God, this just hurts so bad.
Yeah. Did you like stick the Q-tip in too deep, do you think?
I don't know.
Okay. Can you describe the pain for me?
It's dull, I guess. It hurts like hell.
Yeah. Which ear does it hurt in?
It's in my right ear.
Okay. Does anything make it better? Does the pain radiate?
It's just it's like half of my head hurts right now.
Okay. Have you tried anything to make your ear pain go away?
I mean, taking ibuprofen, but that didn't do anything.
Okay.
Because the bottle was empty.
Yeah,
Probably.
that would do it.
Yeah. I'm a teenager, so maybe a beer would help me feel better or something.
A beer?
Like that. Yeah.
That's pretty crazy. How do you even know what that is?
Well, do you have
Somebody let out the
diagnosis?
secret.
I don't.
Somebody let out the beer secret to this teen.
I don't know. I guess I'm thinking maybe like an ear infection if you got or swimmer's ear if you got some water in there in the shower, or if you got the Q-tip, some like wax impaction in the
There you
Q-tip.
go. Your wax impaction. Nice.
Well,
Oh, good job.
your cousin personality was like really triggering. Like I literally felt like I was talking to like a teenage boy.
Oh yeah.
That was great. Great improving.
That was
Thank
great.
you,
That was
thank
very
you.
good.
Yeah.
All
I'm
right.
supposed to be dramatic.
Okay.
So,
Yeah.
Was that the personality trait?
Okay, Anna, you could be the family member
Okay.
now, and Drew gets to be the hapless med student.
Okay.
Okay. Do I share the family role? Is that
You
right?
can, sure.
Okay.
There's no rules anymore to
Okay.
this game that I thought had rules, but I don't care about now.
Okay. I'm also a teenage relative.
Oh, great. Yo, what's going on, man?
Hello, Drew.
My teenage relative? What's happening?
Well, I don't feel great.
Why?
Wouldn't you like to know?
Yeah, that's why I'm asking.
Yeah. Well,
Are you going to tell me or?
I guess if you really need to know. Yeah, I'm really having some stomach pain.
Okay. Why? What do you expect me to do about it?
Well, you're the one that asked about it, and I think you're in medical school or something. So
So you need my help. So you're coming to me.
well,
I feel like
if
are you
that's
about to are you about are you about to ask her for some quid pro quo here? Like, I will help you, but only if you tell mom and dad that I did not go to that party.
Exactly.
I guess if you have to put it that way, yeah. Yeah.
Okay. Have you tried Tylenol?
No.
Do you want to try Tylenol?
I don't think it would help.
Okay.
It's not that kind of pain.
What kind of pain is it?
Well, like, okay, mom made me drive around the other day because I'm studying for my driver's license test, and I just felt disgusting, truly. And every time I get in the car, it's like a problem.
Every time you get in the car?
Yep.
Just when you get in the car or when you're driving?
That's a weird question, but I guess when I'm driving.
Okay, so you have motion sickness.
Yep.
Yeah. I love the taciturn. Like, I'm not going to say many words
That was my personality was stoic to the point of absurdity.
Oh, okay.
Oh.
Yeah, because I
Very
feel like
good.
that is a common, like, especially maybe little dudes, like middle school to high school. There's a period where they're like, I don't need to use words or inflection
Yeah.
or any sort of emotional signifiers. I'm just going to be totally flat and like,
Yeah, that was good. That was
Mhm.
good.
Yeah.
good job. And good job for coming up with
Sorry,
that.
I was so mean.
It's not in Anna's repertoire to be.
No, not
You
usually.
did a good job with it though.
Mhm.
That was good.
Yeah.
That was very good.
Yeah.
Now it's Srishti's turn to be on the hot seat.
Am I?
Yeah. yeah.
Okay. Wait.
So,
I'm the
so I
student,
guess
so you
Drew
gotta-
should be the
Mhm.
family member.
All right, let's do it. Okay.
Hi. I don't think I've ever seen you at the family reunion before. Who the hell are you?
Oh yeah, it's just because I've been at college and I've been doing cooler things.
Cooler things.
Yeah, I'm at college.
Right. Okay. But like, who are you to me?
I'm just a college kid.
With no relation to me whatsoever.
I may or may not have a relation to you.
Okay.
I don't really know.
Okay.
I don't really know. Maybe you're just like one of those like random ants I'm seeing.
Sure. Okay. Sure. Oh my God, I'm an ant. Jesus.
Yeah.
Okay. All right.
Somebody divorced, got remarried, had
That's
kids.
okay. Sure. 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 You look a little constipated, if I won't lie.
I look constipated.
I don't know what's going on with you. You seem a
I
little.
hope
stressed.
I don't look constipated. Been having pretty good bowel movements.
Oh, that's good. That's good. What's going on?
Well, my stomach kind of hurts.
Okay, I just asked you. I just asked you.
I'm having good bowel movement.
Okay, fine. When did this start?
5 days ago.
Okay, what were you doing 5 days ago?
I was at college,
You
know, with the boys,
with the boys. What were y'all up to?
just eating food. Just
Okay,
lots of food.
okay. And that's it. That's all you did. Has anything made the pain better? Do you even want my help? I like don't have to help you.
Do you want to?
Family interaction is going very well.
Do you want to help me?
Do you want me to help you?
Yeah, sure.
Okay. Okay. So what have you done anything to make the pain better?
No,
Could you point to the pain?
it's right here.
Can you palpate your liver for me? No, I'm kidding.
I can't. No.
Can you check McBurney's point for
Yeah,
me?
sorry. Let's just really quick let me get my stethoscope out and do this so that you think I'm a legitimate doctor. How's your appendix?
What's an appendix?
Good. Has anything, did you answer if anything made it better?
Nothing made it better.
Did anything make it worse?
No.
Okay. What did you eat?
Seafood.
Well, that's stupid.
Why?
Because
Okay.
seafood's gross.
That's gross. No, I'm kidding. And you're sure your bowel movements have been okay?
Mhm.
Are you allergic?
No.
How much alcohol do you drink?
Moderate.
Do you smoke?
No.
Do you use any other illicit drugs?
Mm-mm.
Where do you work?
I go to college.
What do you think this is?
I don't know. That's why I'm asking you.
Right, but like, you must have some thought. What are you worried it is?
Probably something to do with the seafood.
Okay. Are you having a reaction to the seafood?
I don't think so.
Have you looked this up on the internet
This is
yet?
the nightmare patient.
No.
Are you nauseous?
Yeah.
Have you thrown up?
Yeah.
How many times?
20 or 30.
And you didn't lead with that?
No.
How many times have you vomited in the past 5 days? Is that 20 or 30 in the past 5 days?
Mhm.
Okay.
As opposed to like a lifestyle that you choose.
Do you
to
just have... Okay, so you have food poisoning.
Yeah.
Okay. we could have made this so much shorter. A random relative of mine who hasn't given me their name nor any sort of idea of how we're related to each other.
Like which specific bacteria would it
How about
be?
you shut up?
Like Vibrio vulnificus,
Oh,
perihemolyticus.
All right. All right,
Wow.
sketchy.com. Relax.
Wow. Okay.
Yeah.
what kind of family member are you?
It just said college kid home for break.
What the hell?
I assume
Dave.
I assume that's the child of a.
So I'm his parent?
Yeah, that didn't work out real well, did it?
No.
Do you think I have? Do you think I have an army of game testers that I can run this shit by? No. That's why I'm always like, this is bullshit. Let's try it.
It's like, I think you made it clear you were in college.
Yeah, that was clearer than
Where
a
do
lot
you
of your
work?
symptoms, to be honest with you.
They're like, where do you work? I go to college. It was crazy.
You really buried the lead with the vomiting. What the hell?
All right, we might have time for one more. Let's do Drew and Nick.
Okay.
Is Anna have you done both?
I think so.
Have we all done both?
Mhm.
Yes.
We, when I say we, I mean you.
Oh, why don't you do it? Why don't you do it?
All right. All right.
We can all be your med student.
Yes, that'll be fun.
All right. Well, welcome back. It's so good to see you. I haven't seen you in a long time.
Hi, Grandpa.
No, I'm an uncle.
Okay.
Oh,
I haven't seen you in a long
Uncle
time. What have you been up
Dave.
to?
You know the usual, just studying all the time, stuff like
How are
that.
you related to us again?
I'm an uncle. I'm your
No,
uncle.
I know, but like how?
I'm your uncle on your mom's side.
Never heard of you in my life.
Well, that's because they don't always invite me.
Okay. Okay.
Well, it's good to see you. How's med school going?
it's going.
Yeah.
Certainly.
It's great.
Mm-hmm.
Yeah.
Good as per usual.
Well, I hope you don't. I hope you're not trying to become like those other doctors.
Yes.
I'm trying to be just like them.
What do you mean by that, Uncle Dave?
You know how doctors are always like, you got cancer. You don't have cancer. Come on.
Have you been told that?
That's just a myth made up by doctors who get, paid by the pharmaceutical companies.
Uncle
They
Dave,
just want you to have cancer.
did your doctor tell you that you have cancer?
No, I'm just saying.
Okay. Just generally.
I'm just saying in
Yeah.
general. You know how doctors are. I just don't want you to be like that kind of doctor.
Uncle Dave, could you tell me what the date is today?
Today,
Do you know where
If
you
I
are?
give you a piece of paper, can you draw me a clock?
Oh my God.
it's the 17th.
Okay.
Yeah, but I have been having a problem. Maybe you can help me with this problem. Maybe you can help me with this problem.
Hey, what's going on?
Well, I'm going through a lot of deodorant.
Oh, okay.
Going through a lot of deodorant.
Have you considered switching brands?
I have switched brands. I've switched many brands.
Okay.
But none of them work.
Okay.
Are you using the deodorant more because you're sweating or because you're smelling?
Sweating.
Sweating.
I don't
Are you using
care if I smell or not.
Okay.
We know.
Just to be clear.
Are you using a deodorant or an antiperspirant?
Antiperspirant.
Okay.
Yeah.
And it's just not doing the trick.
I mean, no. And it's when I apply it to my entire body, it's just hard.
You're applying deodorant to your entire body.
Well, yeah.
Have you heard of just taking a shower?
I take a shower every day.
Okay.
Every single day.
Okay.
And then I get out of the shower and I apply deodorant to my entire body. All of it. Even the bits that you can't see
Yeah.
Great.
or that aren't accessible to the atmosphere.
Yeah.
It doesn't help.
When did you start noticing that you're sweating more? When did that start?
Oh, it's been years. I usually bring it up to these family functions because I'm not invited.
Yeah.
Have you tried to do anything? to help with that?
Aside from applying deodorant to my entire body?
Yeah, like have you thought about like it seems like you don't really trust doctors very much. But have you
Yeah.
thought about going to talk to a doctor?
No.
Why?
Because doctor, they'll just tell me that I need some sort of pill that that big pharma wants me to take.
If your toilet's broken, are you gonna call like an electrician to come fix your toilet, or are you gonna call a plumber?
Well, I'll call a plumber.
So if something's wrong with you, you should probably go to the person who's the expert in like things that are wrong with the human body, right?
So TikTok.
No, that would be a doctor.
Oh, okay.
Yeah.
A doctor. No, I don't know. I'll consider it.
Okay.
But what about you? You're here.
Are you having any other symptoms
No.
besides just the sweating?
Just the
So
sweat.
you're just sweating.
I'm just sweating.
Is that all you have?
That's it.
Do you have
Okay.
hyperhidrosis?
I do. Apparently, I guess I do. I don't know what that word means, but probably I do.
Excessive.
There's a deodorant you can get for that.
Yeah?
Yeah. I don't remember what it's
Is
called.
it a prescription? Because you
No.
know how I don't like doctors and pharmaceutical companies.
No, it's not a prescription. I think it's an over
Just
the
look,
counter.
maybe like clinical strength
Yeah, that's
It's like a
antiperspirant.
little stronger.
Do I have to put it on my entire body still?
Nope.
And no, I don't know why the hell you're doing that.
just your armpits. It's like a little ball thing, you know.
yeah.
Okay.
But if you are sweating over your entire body, maybe you know.
should see someone who could help you.
What are they going to do?
A lot.
You can figure out what's causing your sweating.
Mm-hmm.
Radical idea.
Yeah.
Have you noticed
Youngsters.
maybe are your like eyes like really popping out of your head or something like that? Graves' disease, maybe.
Oh,
I'm just joking.
Say yes.
yes. My eyes are popping out of my head. I think you did. I think you did the things you did. You did great.
That's
Thank you.
You
And my
sweating?
personality obviously was distrust doctors.
Thank you, Uncle
Sweating?
Dave.
That was like really representative of what I'm going home to over Thanksgiving. So
Oh, good.
You got practice.
Nice. I'm glad I could help. Well, that's all I have. Shortcoats, if you have something you want to say about today's show, something you want to hear about someday, a question you have, feedback on this stupid game I made up, go to theshortcoat.com/tell us and send us a message. Otherwise, that's our show. Until next time, I'm Dave Etler saying, don't let the bastards get you down. Talk to you in a while. Say bye, everybody.
see ya.
Bye.